Chiropractors are not real doctors. Chiropractors treat conditions beyond their scope of practice. Chiropractic adjustments are dangerous. Without a doubt, I'm going to tear this one in half. Good afternoon. My name is Dr. Chris Fisher. I am a chiropractic physician. For about 20-some years, I was in America in the state of Idaho. That was my hometown. That's where I grew up, so I did chiropractic there. Had an opportunity to kind of come and look at the Philippines and see what the Philippines was like. I've been here for almost 6 years and doing what I absolutely love as far as chiropractic, helping patients. Chiropractic basically is utilizing the adjustment on a particular joint to be able to relieve pressure on that joint and also to relieve pressure that might be on a nerve. So if you have a nerve that's being pinched here, either by the vertebrae being rotated or the disc bulging out, putting pressure on it, then you're going to have some of those symptoms of the pain. Chiropractors are not real doctors. It's not really true. Chiropractors are in fact doctors. We are doctors of chiropractic. Just like a medical doctor will have an MD degree, which stands for medical doctor, chiropractors have a DC degree, which is Doctor of Chiropractic. Chiropractic isn't suitable for children or the elderly. I have adjusted patients all the way from about 20 minutes old, all the way to right at about 100 years old. That would be a myth. Chiropractic care requires a long-term commitment. This really can be misunderstood a little bit because chiropractic initially really is not a long-term commitment. Most generally, we're going to be within about 3 to 6 weeks time period to be able to get them out of pain. Just because you're out of pain does not necessarily mean that all of the problem is fixed. So this question really has to be kind of qualified just a little bit. Chiropractors treat conditions beyond their scope of practice. I'm going to tear into that. I do some orthopedic tests and it looks like maybe a disc has blown out, then it is out of my scope of practice. I would definitely refer that patient to more appropriate care. Then maybe at some point follow up with chiropractic. Chiropractic adjustments are dangerous. So this one, without a doubt, I'm going to tear this one in half. I was trained at a school called Palmer Chiropractic College in Davenport, Iowa, which was kind of the founding school of chiropractic. And we took hours and hours and hours of classes to know the anatomy, the physiology, the joints, the muscles. We've been taught very well on how to be very safe, to be effective. And if there's something that's out of our scope of practice, then we refer that out. So chiropractic adjustments are not dangerous when they are performed properly and by really a qualified chiropractic physician. 4 years of undergraduate, and then I did 5 academic years of chiropractic school. And then on top of that, I had to go through and take national boards, parts 1, 2, 3. When I graduated, it was 3 parts of a national board. Later, they added a part 4. I went through and took that part 4 and a physiology board. When you get done with your national boards, then your particular state that you go to, most states were required to take a state board. So that's a lot of questions and qualifications just to be this chiropractic physician.
Similar to a medical physician, Dr. Fisher started off with an interview with the patient. Prior to that, the patient filled out an information sheet regarding his medical history, diseases, and medications. He was also asked if he brought an X-ray with him. After a brief assessment, Dr. Fisher applied the Gonstead technique, which lasted around half an hour. Then, the patient received additional treatment from his assistant, highlighting the use of various tools beyond manual manipulation in chiropractic care.
Dangerous.
Western. Scary.
Satisfying after patunugin yung hindi na well kasi meron na rin mga Filipino chiropractor na. Pero ang requirement para maging chiropractor is mag-aral ka sa US or mag-grad.
Safe naman pala siya. Tapos in-explain niya din kung paano siya ginagawa. So, wala naman dapat tuloy.
Though pricey, the relief from pain was worth it. We're now eager for more sessions, finding the adjustments and joints popping satisfying and relaxing.